Good morning, everyone, and thanks for joining us today. Premier Scott Moe and Dr. Saqib Shahab are in the radio room of the Legislative Building in Regina for the announcement of the Reopen Saskatchewan plan, a plan to reopen the provincial economy. Just to note, we do not have any officials joining us over the line today. Premier Moe will have opening remarks, followed by opening remarks by Dr. Shahab, and then we'll have about half an hour for questions. Premier Moe.
Well, thank you very much, and good morning, everyone. Today I'm announcing our plan to gradually, cautiously, and methodically reopen businesses and public services that have been forced to close due to the COVID-19 pandemic, while at the same time keeping many of the rules and restrictions around physical distancing, travel, and large gatherings in effect. It's a plan that has been developed in close consultation with Saskatchewan's Chief Medical Health Officer, Dr. Shahab, and it's a plan that will be conducted in phases. And we will carefully monitor transmission and other factors during each of those phases, and we will adjust the plan if required. As we move through this reopening process, we will continue testing and continue contact tracing, and we will keep a very close eye on the numbers, while always remembering that these are not just numbers. They are people, and they are Saskatchewan people. At the same time, the economy is also not just numbers. It's not just some abstract concept. The economy is the job that allows you to support yourself and your family. And today, that job may be gone. The economy is the small business that you spent your life and your life savings building. And today, that business may not be open. They are also Saskatchewan people. So we have to find the right path. We have to find the middle ground that continues to keep our case numbers low and keep Saskatchewan people safe, while at the same time allowing for businesses to reopen and Saskatchewan people to get back to work. So with that goal in mind, here's our plan. Over the next several weeks, restrictions will be gradually lifted, adding more types of businesses to the allowable businesses list, meaning that they can reopen if they choose. All businesses and public venues will be required to continue following good physical distancing and cleanliness practices to protect both their employees as well as their customers. And customers will be expected to follow the physical distancing rules, and most importantly, to stay home if you are feeling unwell at all. All of the safe physical distancing rules and restrictions that businesses will be required to follow have been compiled in one comprehensive document called the Reopen Saskatchewan Plan. And this document can be found on the province's COVID-19 website. And it's also provided as part of the media package here today. These restrictions will be lifted in phases, and those phases and the businesses included in each of those phases are also outlined in that Reopen Saskatchewan Plan on the government website and in the media package. As always, if anyone has any questions, you can call our business response team support line at 1-844-800-8688. So phase one will begin on Monday, May the 4th. And on that date, medical services such as dentists, optometrists, opticians, chiropractors, physical therapists, and occupational therapists will be allowed to open. All medical service providers will be required to take precautionary measures, such as the use of gloves and face masks when physical distancing may not be possible. And because of this, we recognize that it is possible that some of these providers may not be immediately able to deliver all of the services that they normally would. As Dr. Shahab said the other day, with the weather warming up, and we are seeing that, people are wanting to spend more time outdoors. And that's a good thing, as long as it's done safely. So as part of phase one, some outdoor activities will also be allowed to open, with restrictions over the course of the next number of weeks. For example, parks will be open for boating and fishing on May the 4th, while overnight camping can begin on June the 1st. Camping areas will currently be operating at 50% capacity so that every other camping spot will be able to be empty. And until further notice, Saskatchewan's parks will be restricted for overnight camping to Saskatchewan residents only. The online reservation system for our provincial parks will open on May the 4th. Golf courses can open on May the 15th, just in time for the May long weekend. Golf courses and golfers will be required to follow a number of physical distancing rules, such as one person on a golf cart and elevated cups in the hole so that you don't actually put your ball into the hole and have to place your hand in the hole to retrieve the ball. Phase 2 of our plan will begin on Tuesday, May the 19th, just after the May long weekend. In Phase 2, currently restricted retail stores and some of the personal services will be allowed to open. Retail stores including clothing stores, shoe stores, flower shops, sporting goods stores, and electronics stores. Personal services allowed in Phase 2 will include hairdressers and barber shops, acupuncturists, acupressurists, and massage therapists. Again, all of these businesses will have to follow practices to protect their employees and to protect their customers. And those guidelines, again, are available in the comprehensive document that is provided on the government website. At this date, we do not have dates set for any subsequent phases. Those dates will be decided in the weeks ahead after careful monitoring and the impact of these first 2 phases. Phase 3 will see restaurants and bars reopen at 50% capacity. Other personal services that may not have been included in Phase 1 or 2 will be allowed to open in Phase 3. Phase 4 will see recreation and entertainment facilities begin to reopen. Those would include facilities such as gyms, swimming pools, theaters, casinos, and museums. And finally, Phase 5 would be the consideration of lifting some of the broader and the longer-term restrictions that are in place, but that would be considered many weeks down the road. Now, I know that some will be concerned that this is far too soon, that reopening businesses in the coming weeks could increase the spread of COVID-19. And I think it's important for us to remember that over the last number of weeks, there has been many retail stores in Saskatchewan that have remained open. Grocery stores, for example, hardware stores, pharmacies, banks, and liquor stores have all been allowed to be open, and these businesses, we have observed, have implemented new practices, limiting the number of customers in their stores, for example, ensuring physical distancing for the safety of employees and their customers, increased their disinfecting of all surfaces, and as a result, we have not seen major outbreaks that have started at Saskatchewan businesses. We have flattened the curve, even as these businesses have remained open over the course of the last number of months. This gives us confidence that Saskatchewan business can reopen and keep their customers and their employees safe by maintaining similar practices across the sector. That said, we will carefully monitor the case numbers each and every day, and we will adjust our plan accordingly if required. So let me be clear that many of the physical distancing restrictions and rules are going to remain in place. Restrictions designed to prevent some of the highest risk activities. And as we have said before, we know that travel was the source of many of the early cases of COVID-19 in Saskatchewan, and we continue to strongly discourage all non-essential interprovincial and international travel. And anyone who does return to Saskatchewan from any other country, including the United States, must self-isolate for 2 weeks. We know that some of the largest outbreaks in Saskatchewan were also due to large social gatherings like curling bonspiels or snowmobile rallies. The restrictions on public gatherings remains in place at this time. Other than allowable businesses, public gatherings remain limited to no more than 10 people. And we know that the largest risk and the deadliest outbreaks in our nation have occurred in our seniors' long-term care homes. So all current rules and restrictions for long-term care facilities will remain in place for the foreseeable future, and this is to keep our family members in those very facilities safe. By proceeding with caution, by maintaining restrictions in those most high-risk areas and activities, and by continuing with good physical distancing and cleanliness practices, I believe that Saskatchewan can find the right path. I believe we can carefully and cautiously begin to reopen our province while still protecting Saskatchewan residents from the spread of COVID-19. So now at this point, Dr. Shahab and I would be happy to answer any questions.
We'll take our first question from the floor. Steph?
Yeah, Dr. Shahab, do you anticipate that when these restrictions are opening, will start lifting next month, that we are going to see an increase in COVID-19 cases? And if so, what kind of an increase can we expect to see?
So I'll just begin by saying that what we have learned over the last 6 weeks is as follows. We've learned that you can go shopping in a very safe way, as well as everyone follows the recommendations. So that means that business owners have to set up their business so that physical distancing is maintained, and people who go shopping should only go shopping if they are not unwell, and they also have to cooperate with the business to maintain that physical distancing. So based on that, we would like to see no increase when people are engaging in other allowed activities as it relates to commercial activity. We also have learned that when people go to work in essential workplaces, for the most part, we have not seen any transmission. But as long as people are observing the recommendations, including physical distancing, hand hygiene, not getting together in breaks to share food, even if there is a case, you may get some limited secondary transmission, but that is controlled quickly. So I think it will be essential that if we do see transmission in those settings, we are able to control that quickly. So that means that as soon as someone is symptomatic, they self-isolate and call Healthline for testing. So from that perspective, we will continue to investigate each case in detail and obviously control any transmission through case contact investigation, but also use that experience to further advise settings in which transmission has occurred. So that was for situations where physical distancing should be maintained. For areas where physical distancing cannot be maintained, we already learned from the healthcare system that you can safely care for people with COVID-19 and prevent further transmission either within healthcare workers or other patients. So those lessons have to be applied now in healthcare settings outside of hospitals, so a lot of the medical services which are in phase 1, and also have to be applied in other personal services that will be allowed in phase 2, where through appropriate use of personal protective equipment and other measures, you can safely provide services which are less than 2 meters, where physical distancing is not maintained, in a way that limits further transmission. But again, if transmission was to happen, we will investigate in detail, understand what was there that could have been improved, and advise and provide that feedback to the providers and to the public. So we will see ongoing transmission. We hope that will remain as low as possible. We want to see the curve remain flat during the reopening phase, and we want to learn from that and provide continuous feedback.
Follow-up, Steph?
Yeah, for the Premier, I understand the need for people to get their teeth cleaned and for their hair to get cut, but these seem like relatively high-risk activities because you can't maintain physical distancing performing those services. So why are those in the early phases of this plan and not in the later?
Well, listen, the entire plan, including the phase 1, the personal services, has been worked on in consultation with not only Dr. Shahab, but also the Saskatchewan Health Association. And we have, in phase 1, the number of services are personal health services, if you will. These are also services that, to a large degree, practicing with personal protective equipment, practicing providing their service is with the proper standards in place with respect to cleanliness, with respect to disinfection, is not foreign to these services. For example, at a dentist office or many of these services that are being provided. So this is an extension really of some of the healthcare services that are already being provided across the province. Some of these services have been provided even throughout the last number of weeks on emergency basis, if you will. And so this is what we had felt collectively is a good place to start to reopen some of the services that the Saskatchewan people require, and then a second wave of those personal services will be coming in phase 2. But I think it's also important for us to understand that between these phases, and we have put dates on phase 1 and phase 2, but not on phase 3, 4, and 5. And those dates will be determined by the results that we see as we step into this area of reopening businesses and services in the province.
We'll take our first question from the phone line. Operator?
We have Murray Mandrick with the Leader Post.
Good morning, sir. Given that you don't have a date for phase 5, which is the big crowds, isn't that in essence saying that we just cannot plan for Rider Games, the CFL season, Big Valley, Country Thunder Jamboree? It would seem to be that none of this will be permissible by the time, by a realistic time, anything will start.
Well, yeah, without having dates on phases 3, 4, and 5, I think what that speaks to is those dates would be determined as per the results that we see with the implementation of phase 1 and 2. If we start to see a small increase in active cases here in the province, which I don't think would be unexpected, but a manageable increase here in the province, that we would then have a good look at the next phase. I don't think we would be looking much past the next phase over the course, being phase 3, over the course of the next number of months. This needs to be, primarily about keeping Saskatchewan residents safe, but it also is focused with finding that right path, finding the path of how we can open up some sectors of the economy that have not been allowed to be opened up over the course of the last number of weeks, and allow people to get back to work. So the results during phase 1 and phase 2 will ultimately determine the dates for future phases. So I don't think it's a time yet for us to make comment on large public gatherings. We just don't have the information at this point.
You have a follow-up, Murray?
Yeah, but given that phase 2 starts on May 19th, and given that you'll need a considerable period, one would think, to calculate the results, we're looking probably June, July before we're even into phase 3. So phase 4, phase 5 doesn't seem like they're going to be something that are going to happen this summer.
That would be a conversation that we will continue to have with all of those that are interested in having that conversation, whether it be the CFL or other sporting leagues, whether it be minor sporting leagues that are where our youth are participating in sports right across this province. I know in the community where I live, there's youth dance, there's youth ball, there's softball, there's kids that want to play lacrosse. So that's just at the minor level. Never mind the large, the public gatherings that we would have with professional sports and other events like, for example, Country Thunder, that we know many people would like to attend. But it's just too early for us to make any determinations with respect to whether or not those types of gatherings with that number of people would be allowed to carry on. If you have anything to add from your perspective, Dr. Shahab, but I think it's fair to say this isn't a conversation that we've been focused on exclusively as of yet, as we're trying to work through the first number of phases and ensure that we have the tools in place in the way of testing capability, contact tracing, and the ability to isolate localized flare-ups today.
So what I'll just like to add is that, like the Premier said, it's really positive that we are able to reopen in a very organized way. And the reason we can do that, again, as the Premier said last evening, is because we've all been practicing physical distancing and other measures to keep the curve flat. And so as we go forward, it's not really back to business as usual. It's going forward to business in a new normal for the next little while. And we will continue to learn from that, but we already know that settings where there's close proximity of people in gatherings, where there's shouting, singing, laughing, crying, hugging, or other close contact, we already know transmission happens very quickly. We have a reproductive transmission rate, RT, of less than 1, which means that each case transmits to less than 1 person, and that is essential to keep the curve flat. We already know that in gatherings in Saskatchewan, we've had situations where one person has infectious person has resulted in transmission of 10, 20 people. And so again, that is the risk of large gatherings. And at this point, that's why those are not being allowed. But we need to continue to learn from what we see and see what would be the possibilities in the future to maybe allow some events in as safe manner as possible. But like the Premier said, at this point, we need to understand how we can safely allow some businesses, some recreational activities where the risk is already low by virtue of how they happen, and learn from that, and then move forward in a very systematic way. Thank you.
We'll take our next question from the phone line, operator.
We have Bonnie Allen with CBC.
Yes, can you hear me?
Yes.
Hello?
Yes, we got you, Bonnie.
Yeah, okay, thank you. You've noted that aggressive testing is key to this strategy, but we've seen the demand for testing decrease despite your capacity. Fewer people are seeking out the tests. So when are you going to stop doing defensive testing and start doing offensive testing, not just in response to people and symptoms?
I think Dr. Shahab would be best to answer that question. I would just at the outset state that when we have access to testing capability that may be able to test antibodies, for example, we may look at a little bit of different testing parameters that Dr. Shahab may speak a little more in depth to. But at this point in time, we have one of the most accessible tests, if you will, for residents in Canada is right here in Saskatchewan. We do have the capacity to go beyond the testing numbers that we have today, and we are fully prepared, if needed, to provide those tests if required. Dr. Shahab.
Thanks. So just a bit of details on the testing capacity as it stands today and the testing numbers. So obviously we have the capacity to do in excess of 1,000 tests a day, like the Premier said, a target of 1,500. Testing has gone down, like the SHA said in its media briefing, due to a variety of reasons, less coughs and colds, less people getting fevers. And yes, we want to make sure that anyone with any symptoms, even during flu and allergy season now, as we get into that, does consider testing if their symptoms are unusual. Call Healthline. That's one way of maintaining and enhancing testing once cough and cold season, flu season ends. We are very reassured by the fact that overall our testing numbers have been 23,000 plus, with a test positive rate of 1.3%, so fairly low, which means that we are doing a lot of testing. If our test positive rate overall had been higher, we would have been concerned that we need to do even more. And I have to also emphasize that we looked at our numbers from last week. So 13th to 18th April, we did in excess of 4,000 tests. So not as much as more than 1,000 tests a week, but slightly less than that. But even there, our test positive rate was 0.4%, which again is very important, because what it means is that even though we had a lower overall number of tests and we want to maintain that as high as possible, our test positivity rate is not high, which means that we are not missing cases based on that number. Having said that, we do want to increase our focus on testing where there's a cluster or an outbreak, either in an institutional setting where we may test everyone, even if they're asymptomatic, or in other settings where it may be useful to understand a bit more that are there mildly symptomatic or asymptomatic cases within the contact. But having said that, I think that is also a reflection of why we also need to do everything else at the same time, which includes physical distancing at all times, because we do understand that in rare occasions transmission can happen when a person may not be symptomatic and may not even be aware that they are infectious. So testing is important, maintaining physical distancing is important, and case contact follow-up right away is important. So all these three pillars are essential as part of the offensive strategy.
Do you have a follow-up, Bunny?
Yeah, you noted the recommendation that interprovincial travel not be done unless it's essential. But what consideration have you given to beefing that up? Something with a bit more teeth, further restrictions or enforcement, highway patrols, anything that would clamp down on people going to and from Alberta, for example?
Start that, no, maybe Ian.
So I think at the end of the day, individuals to a large extent need to do a risk assessment of the need to travel. And I think so far what the feedback we've been getting is that people have been doing that very in a very conscientious manner, not just for interprovincial travel, but even travel within the province. I think people enjoy the outdoors close to their homes. As they look at recreational activity, it will be close to their homes, not a lot of travel even within the province that's far from your own home. So for the most part, people have been very conscientious, and at the same time, we understand that there has to be travel that may be essential from a business perspective, or that may be essential from a family perspective, that really does need to be supported in a safe manner. So from that perspective, I think it's less a matter of someone policing this behavior, but rather a matter of individuals just making that risk assessment and keeping travel as low as feasible, and even information from Google Analytics and other third-party demonstrates that for the most part people are staying at home or close to home, which really needs to continue.
We'll take our next question from the floor. Arthur?
There's a few things that I don't see in this plan, and that includes when schools and also universities might be allowed to reopen and when elective surgeries might be able to resume. Could you talk about what kinds of considerations will dictate when that would happen, and just provide a bit more clarity about what you're considering?
Sure. With respect to schools, universities would be the decision of the institutions as they made the decision on their own to go online. I would likely expect for the most part that would continue throughout this term. With respect to schools, there really isn't an opportunity for us to have a discussion around reopening schools in the next number of weeks. And as we get into the end of May, early June, we're nearing the end of the school year, and I expect that we would have a discussion at some point as to whether it would be worth the risk to open the schools for just a week or two at the end of the year, or allow them to continue to be closed and hope to reopen this fall. So that's where the K-12 school system is. And the second part of your question was? Surgeries.
Yes.
Surgeries. I have asked the Minister of Health and the SHA to look at what opportunity we may have to start to bring back online some elective surgeries here in the province, and they are, as we speak, looking at what type of a reintegration of some degree of elective surgeries would look like, and they'll be coming forth with information of that in the near future.
You have a follow-up, Arthur?
First, on schools, is there a chance that they could continue to remain closed into the coming school year in September? And further, you were talking about the need for cases to remain manageable, and I believe that you talked with Dr. Shahab, the RT being a key factor here. Can you just talk about what the threshold would be in those terms that would dictate how you move through these phases? Is there a specific RT or a specific rate of cases that you're looking at that would dictate when we move into phase 3 and 4, and when and if some of these phase 1 and 2 restrictions snap back into place?
You go ahead, and then I'll make a comment on the schools.
Yeah, and maybe I'll just make one comment on the schools and as well, where some countries in Europe and other parts of the world have cautiously opened schools up to, for example, elementary school level, aged 12 or 14, because there is an understanding that transmission may be lower in younger age groups, and health outcomes may be lower as well. But of course, we have to understand that there's also other staff who work in schools as well. But I think we're going to watch closely in those jurisdictions what their experience is from over the spring with school reopening, and that's a comment around schools. And then around what's the threshold for concern. Obviously, our case numbers have been, for the most part, new cases have been under 10. Certainly, there's two aspects of that. If our case numbers start going above 10, certainly above 20, we'll need to understand what is the setting for that exposure. If we can explain the setting, if it's an unfortunate outbreak or cluster, at least we can explain all those cases linked to a geographical area, to an outbreak cluster, and we have to manage that very quickly so that it doesn't spread further, but at least we can explain it. But if we see lots of unexplained community transmissions popping all over the place, we still need to go deep into the case contact investigation. We were discussing earlier that all of us should be able to name all the people we've been in close contact with over the last 2 weeks as a new normal. And we need to always say that, okay, did I come closer than 2 meters to anyone outside my household where I could not have? But as long as we maintain physical distancing and we are able to investigate each new case, if we see an increase in community transmission where there was no link to a known case, and certainly if that goes above 20 or 30 or the RT starts creeping up to near 1 or above 1, then we will have to again look at that very closely and try to see, is this happening because of certain exposure settings where we need to cone down on a bit more, or is there other factors that are involved, and try to understand that. And then that will inform obviously where we are in terms of the reopening of activities, or do we need to make some adjustments in that plan?
So with respect to schools opening this coming school year in the fall, that again will be determined by how the next number of months go with respect to our battle against COVID-19, because it's not expected that we would have a vaccination, obviously, by this early fall when schools resume. So that will yet be a decision to be made. That being said, our youth are not a high-risk group, if you will, of having severe effects of COVID-19, but maybe a higher risk group of transmission of the disease. Dr. Shahab made some comments with respect to the parameters that we'd be watching and may determine whether we move ahead with additional phases of this reopen Saskatchewan plan. And before we even begin with that, we need to understand that we will see, whether we move forward with these phases or not, we will see localized flare-ups in certain communities, in certain areas of communities, in for example, potentially a long-term care home here or there. And it's important that we have the robust testing regime in place. And I hope we're here in a year where someone is asking me why our testing numbers are low, because people aren't presenting themselves, which means this virus does not have a foothold in our communities. That's a good sign. But we do have the capacity to test vigorously when we will have a localized flare-up. We have the contact tracing resources in place with about 500 people now available to contact trace any positive tests that we have. And this is where we should all in this province be asking ourselves the question, who have I been in contact over the course of the past 2 weeks? And the answer to that question should in many ways determine what you do today and who you become in contact with today. And last but certainly not least is we do have the capacity and the resources to ensure that those that have been in contact or have tested positive can self-isolate, can isolate this virus into wherever that localized flare-up may be. And it's important for us to understand that where and why that localized flare-up may occur may not have anything to do with some of the phases and steps that we are doing in order to reopen Saskatchewan. It may be something totally different, but something that most certainly needs to be addressed by possibly an order, possibly some further recommendations to ensure that it doesn't occur in other communities. So it is important that there may not be one metric that determines that we will or will not move ahead with, let's say, phase 3, or that we would extend or move sooner, even potentially with phase 3, but there are a number of metrics, and one of those may be actually where that and why that localized flare-up has actually occurred.
We'll take our next question from the phone line. Operator.
We have James Keller with the Globe and Mail.
Hi there. I'm wondering about the reality of having different provinces on different schedules when it comes to lifting these restrictions and physical distancing. Do you see any concerns here in terms of a national response and communicating these measures to the public? And likewise, if a neighboring province ends up moving faster than Saskatchewan, what risk does that pose to the province?
Well, I don't think there's a risk either way with provinces lifting restrictions or looking at how they are going to reopen certain sectors of their economy for the simple fact that each province is at a different a different stage or in a different situation, if you will. And often those provinces aren't even that far apart, and they may be in those different stages. For example, we have many similarities with the provinces on either side of us, and there still is some necessary travel that will occur there. We are Canadians first and foremost, but our restrictions came on at different points as they were required in our individual provinces and territories, and our restrictions will come off across the nation as we are all in different places when it comes to how COVID-19 has been dealt with and what the results of that have ultimately been. So we're working very closely in saying that with all of the other provinces. I'll be on a Council of Federation call later today with all of the other premiers. We've shared this plan with any of those provinces that have requested it, and we'll be working very closely with the knowledge that we have and the knowledge that my counterparts have across the nation as the chief medical health officers also sharing that information to align where we can, but understand that there are regional differences in where we are with our COVID-19 approach, the results of that approach, and where we are respectively with the different impacts on our economy. We're a very diverse nation from coast to coast to coast, and that should surprise no one that we got into this at different stages and will be coming out of it at different stages.
You have a follow-up, James?
Yeah, and likewise, what has the discussion been with the federal government in terms of this plan, if there's been any, and what's the back and forth been there?
Yeah, sure. We've shared it with the federal government as well, our stages, and also shared with them that we feel, given Saskatchewan's situation, that this is a very cautious but methodical approach to reopen some sectors of our economy here in the province of Saskatchewan. We have the testing capability, we have the contact tracing capability, and we have the ability to ensure that we can address any localized flare-ups that may come, understanding that over the last couple of weeks, we seem to have been able to approach with some success the general provincial numbers of COVID infection rates here in the province. So we're well poised to be where we are here today. And I would just say that the reason we are here where we are today is because of the hard work that the Saskatchewan people have done. When you go grocery store shopping, I think across Canada, but in Saskatchewan, it's a very different experience than it was 6 or 8 weeks ago. And we expect that experience to be replicated in any other retail stores or personal services that we're looking at reopening here shortly.
We'll take our next question from the line, operator.
We have Mark Smith with CTV.
In phase 1 and 2, it says the size of public and private gatherings will remain at maximum of 10 people. Does that include people from different households, like a family getting together for a backyard barbecue or anything like that, or just getting together to spend time together? Will that be allowed?
Yes, thank you. So I think it's really important for each family, each household to look at in terms of what is the situation. Do they have a family member who is at high risk, either because of age or underlying health conditions? I think certainly all of us, as we are out on a walk, if we meet someone or want to chat, we step away from the path to let others pass with that 2-meter separation. And if you want to talk to someone, you don't have to come right to that 2-meter distance. You can stand, 2, 3, 4 meters apart and have a bit of a chat. If you have pets with you or kids, you don't want them interacting too much either. So that's where we've been for the last 6 weeks, and that's worked really well. Obviously, if people want to interact, we've had that discussions that you can make a virtual household of 2 or 3 households where everyone's well, everyone understands that there may be a bit of a risk if you interact, but as long as everyone is well, you try to have a virtual household of so that you can meet as a group less than 10, but try to meet the same people or the same household for the next little while. Don't randomly meet 3 new people every day, because I think that's where the risk goes up. Yeah, and even when you meet, be conscious of the physical distancing. Be conscious of, as you within a virtual household, if you share a food or a meal, just be that conscious, because we have seen that in those settings, through shared items, whether it's recreational or sharing food, transmission has happened. So as long as people are comfortable and they can keep their interactions to limited to 2 or 3 friends or virtual households for the most part. That would be something to sustain us for the next few weeks, but minimize the risk of transmission that can come from a larger gathering or meeting lots of people where you're not maintaining physical distancing in an ongoing fashion.
I would just add to that, to continue to practice good physical distancing, but is it okay for close friends, family, or a neighbor to come over and maybe have a barbecue in your backyard? I think it is. If you practice good physical distancing to keep yourself safe, but also to keep those around you safe. You should always be thinking of who I've come in contact with over the course of the past 2 weeks, and those are the people that ultimately you are making every effort to keep safe by ensuring that you are practicing good physical distancing measures. I have a son that I haven't seen for 6 weeks. I'd love to have a barbecue with him and cook a locally grown and processed steak sooner rather than later, and I think we will.
Do you have a follow-up, Mark?
Yes, if say phase 1 and 2 are in place and we see a spike in cases, do we go back to where we were before? How do we phase backwards?
It depends on where those cases are coming from. If they are cases, for example, that may have be in a long-term care center, and we determine that the cases are not from anything that has occurred with reopening phase 1 or 2 through our aggressive contact tracing, it may not affect anything at all with respect to the phases that we are doing. If we find that those cases are through aggressive contact tracing traced back to one in particular business or suite of businesses, we would look at honing in very closely on that particular business or those particular businesses in that sector to ensure that we are doing everything to keep Saskatchewan residents safe. So the answer is not as simple as if there is a spike in numbers, will that cause the entire plan to go on hiatus? The answer is to understand precisely why that spike in numbers is there, where it's coming from, and how can we address it. Anything to add to that, Doctor?
Yeah, so again, I think public health staff stay till the last case has been reported in the evening and follow up each case and contact in great detail. And thank you to all the people who have collaborated with public health for those late evening calls and follow-up calls to share their information in a very confidential way. But that has allowed us to continue to understand transmission risks. So a few weeks ago, we did see a bit of a signal that people who were going shopping were overall not getting infected, but in rare instances, it was the few community transmissions we had, the few, 30 or so, within them, there were a few people who were more likely to be shoppers than non-shoppers. So again, we updated our guidance, reinforced the guidance for shopping. Grocery stores reinforced their own practices, and obviously other businesses now must learn from that experience. They must observe how essential businesses that are open to the public have managed their business, and in many cases, they have gone above and beyond the recommendations. If you go to I went to get my tires changed, and again, it was well above and beyond what the recommendations are. And so again, I think we all need to learn as business owners, as customers, from best practices that we see all around us. And certainly if we see cases, like the Premier said, we will go deep into as much as we can, understand the transmission dynamics, and provide that feedback to business operators and the public in terms of how we can continue to improve how we work and play in this new normal and keep our transmission rates as low as possible.
We'll take our next question from the line, operator.
We have Lisa Schick with CJME.
Hi, my question is regarding childcare. In the first two phases, there could potentially be a lot of people going back to work, but a lot of these people have kids, and any expansions on the number of kids that daycares can have doesn't come until 3, and schools are still going to be closed. So what do you say to these people about what they're going to be able to do to their kids if they went back to work?
Well, there still is what I would consider some reasonable capacity with respect to childcare here in the province. We have been in touch with a number of childcare operators, both in-home as well as public operators, and there is some capacity for us to start to work our way through these phases. These phases are based on reducing the risk spread of COVID-19. We can work through those challenges as we work through the phases. I would also add that we have continued to keep open our child care facilities in the school settings across the province throughout this. We've reserved those child care settings for our essential services, essentially our healthcare workers and others that are providing the services that our economy or our communities, pardon me, absolutely need. So there is some capacity there as we speak, but most certainly that is one thing that is on our mind as we reopen phases of our economy, and we're hopeful we'll be able to address it as we find our way through this.
Do you have a follow-up, Lisa?
Yes, I'm just wondering what kind of enforcement and or teeth that these are going to have, because there are a lot of requirements that are in this document for places to have when they do open. So are you going to have more people going out and checking these things? Are there going to be fines if they aren't following them?
I would say, first of all, the businesses that have been open over the course of the last number of months have gone above and beyond in many cases, in virtually all cases, with respect to adhering to good physical distancing recommendations and adhering to ensuring they are disinfecting surfaces, disinfecting ATM machines, all of those localized points of contact. And we should be very proud of that here in Saskatchewan, as have people by far and away been have adhered very closely to Dr. Shahab's physical distancing guidelines, his recommendations, and I think that is the largest reason why we are able to have this conversation that we are today. As we allow more businesses to be on that being allowable to be open list, it is our expectation that no one wants to be that business. They don't want to be that business that has inadvertently maybe not adhered to one of the recommendations, not made every effort to keep not only their staff but their customers safe. And so it is our firm belief that Saskatchewan businesses, Saskatchewan employees, and Saskatchewan customers are going to do everything they can possibly do to ensure that they are minimizing the risk, minimizing the spread, as we have been doing for the last number of months. In saying that, as I said earlier, if we determine through contact tracing and aggressive contact tracing that there has been an issue with a particular business or with a particular sector of businesses, we will move very quickly to ensure that we can not only isolate those that may have tested positive or those that may have come in contact with someone that tested positive, but isolate very quickly any issues that may be present in allowing that virus to spread in that particular instance. So that is the reason that we have the testing capacity, and have worked very hard to ensure we have the testing capacity and the contact tracing capacity that we have here in the provinces to jump on those localized flare-ups before they become a province-wide issue. Dr. Shahab, anything to add to that?
Yeah, so I think I'd like to reemphasize that if we had continued as business as usual, we would have seen an exponential growth in cases, and our health system would have been in crisis. So I think we need to remember that the risk has not gone away. But on the other hand, we have also seen that even if we found that there was a case who said, you know what, I became symptomatic today, but 2 days ago or 1 day ago, I went shopping. Or no one should go shopping if they're sick, but even if someone said that they did go a day before and they realized then the next day they were sick and they got tested, we have found that because of all the measures that are in place, we have not seen transmission when a person went shopping or was at work in a grocery store or other setting, and that is all because of all the measures in place. So I think that is very reassuring, but I think it's also then very important that we still remain very disciplined as more and more sectors open up. We have to maintain that discipline, and that is the only way that we will keep the curve flat.
We'll take our next question from the line, operator.
We have Roberta Bell with Global.
Hi, my question is regarding whether we're expecting an increase or whether we're expecting the curve to remain flat. Does this mean that we think that we've peaked here in Saskatchewan regarding the growth of our cases?
So obviously the modeling and other tools did predict a certain peak in terms of worst case and best case scenarios. But I think we need to congratulate ourselves that we have managed to keep the curve flat. And as far as we can see, we did not actually go up to a certain peak, which is very reassuring. But as we reopen sectors, we need to keep the curve flat. And like the Premier said last evening, that is up to all of us. All of us have a role as individuals, as citizens, as people who operate businesses or work in them. And again, I would caution that in other parts of the world, one individual has resulted in a few dozen cases who have then led to a few hundred cases or to a few thousand. So one case can result in thousands of cases within a matter of weeks. And that is why we should be under no false illusions that COVID-19 has gone away. COVID-19 is very much in Canada, in Saskatchewan. But if we practice the way we have been practicing in terms of our day-to-day lives, in terms of our the way we engage when we go shopping, if we continue to practice that, we want to see that curve remain flat. But I think we need to be very conscious as we re-engage in some of the other activities that are going to be permissible over the next weeks to maintain that discipline in terms of preventing as much as possible further transmission.
Do you have a follow-up, Roberta?
Yeah, so are we going to be expecting that we've peaked then? Like, are we using that language, or are we thinking that way as we proceed with this plan? Like, do we think that this is the constant that we're going to be sitting at, or are we actively expecting further growth?
So obviously the best case scenarios have been revised downwards for Saskatchewan. So that's very promising for us as residents of Saskatchewan. That's very reassuring for the health system. But I think we want to stay flat. We don't want to see any peak. And again, will that happen? I think that is certainly our hope. And that's what we want to see. And of course, we will have to continue to watch our numbers very closely, continue to readjust our approach as we move forward, and continue to communicate in a very public and transparent way what we are seeing, what are some of the reasons for that, and how we can mitigate transmission in general, but obviously small outbreaks and clusters and the settings in which they are happening.
I would just add to that, and I won't comment on whether or not we have peaked with 326 cases in total across the province. I believe about 80% of those have recovered. But what we are turning our focus to is a few things, because we have most certainly flattened that curve here in Saskatchewan, and over the course of the last 2 weeks, we have seen a very low rate of positive infections here in the province. It's our hope that that will continue. Regardless of whether we phase in with certain sectors of our economy, we are going to have localized flare-ups in certain communities, certain areas, and we need to be prepared to identify those, to ensure that we have the contact tracing in place so that we can find anyone that has been in contact with those positive IDs, whether they be 1 or 5 or 10, and ensure that we're able to isolate that to that specific area, that specific building, that specific community, isolate it as tight as we possibly can so that it does not become a provincial-wide issue. That is where we are turning our sights to, and we feel we have the resources in place to manage that in the weeks and months ahead.
We'll take our last question from the phone line, then we have a couple last questions on the floor here, operator.
We have
discussions with Chemical or SSR Mining about reopening Cigar Lake and how they can proceed in resuming production in their respective mines?
Not in the last few days, but thankful for the efforts and initiatives that they have put in place to keep their employees, of whom they value very much, safe. This is another example of the impact this is having on our economy. We are an export-based economy. We have uranium, potash, agri-food products, manufactured goods, energy that we provide to the world. And Cameco and others have been very, very proactive in ensuring the safety of their employees in these northern remote camps and locations. But we'll be working closely with them to ensure that if they choose at some point to phase back into production, that they'll have the support of this government and the SHA to ensure that where they have questions with respect to policies, that they have all of the information required. Our experience has been that in many of these situations, that like many of the businesses in every community across Saskatchewan, is that employers collectively with their employees are going far above and beyond what could ever be expected in their personal physical distancing and in the policies that they are putting in place, whether it be a mine in Cigar Lake or a grocery store in Assiniboia, Saskatchewan. So we are very appreciative of that, and the reason that we have are even able to have this conversation today, I would say, is because of all of those efforts collectively of all people across the province.
Do you have a follow-up, Dan?
No, thanks.
Great. Go to a couple last questions on the floor. Arthur?
So, as far as I can tell, we're the first province to unveil a plan for reopening the economy. Why take the risk of being the first instead of waiting and seeing what happens in other jurisdictions? I mean, why should Saskatchewan be the guinea pig or the canary in the coal mine here?
Do you want to speak to that first at all, and then I can speak to it, or vice versa?
So I think, first of all, I think we need to understand that this is a marathon, not a sprint. So COVID-19 is going to continue till such time that there's either an effective vaccine or effective therapeutics. So obviously, each jurisdiction has to look at what is the context and the setting in which they are today. So Saskatchewan today is at a setting where there's a low transmission happening. Spring and summer are coming. So it is important to move ahead in a way that individuals can enjoy the outdoors in a safe manner as possible over the spring and summer. Businesses can continue and people can get services they need, which may be healthcare, not just limited to urgent healthcare, but other healthcare needs or other personal services in as safe a manner as possible. And then we need to continue to monitor closely how that progresses and readjust accordingly. And there may be situations where we may have to relook at specific sectors, or if we were to see an increase in cases, we may have to readjust some of our own understanding of what is safe to continue at that time and what may need to be readjusted based on what we are seeing.
I would say you'll see other provinces taking a very keen eye to this, as I know there are other provinces working on precisely how they can reopen sectors of their communities and economies that have been closed down. And I would expect in the next number of days you'll likely see other provinces coming forward with what their plans look like, and a variation of dates for implementation to maybe no dates for implementation, depending on their specific situation. In Saskatchewan, our situation is that we have had for the last couple of weeks very low infection numbers. We have, last I checked, still the second highest rate of testing in Canada. And we should also note that Canada has some of the highest testing rates in the world. Canada has done very well when it comes to having that initial identification process in place. The other piece I would just reiterate from my previous statement is Saskatchewan employers, employees, and people in general have taken the advice of our Chief Medical Health Officer and have adhered to that advice very closely. That, in a large way, is why we're able to have this conversation in Saskatchewan. And I would say the success of the relative success that we have in reopening portions of our economy is a responsibility of each of us as individuals and collectively as people of the province. If we continue to do what we have been doing, I think we will be just fine over the course of the next number of days, weeks, and months. In saying that, this government is taking every precaution in ensuring that we have the robust testing ability and capability. We are prepared when it comes to contact tracing. We have the ability to isolate those areas of our communities or sectors of Saskatchewan that may be required to be isolated. Alongside that, the SHA has been working very hard ensuring that our medical system is, our healthcare delivery system is in a place where it is prepared for whatever might come at it, whether that be the absolute worst case scenario or what that may be, and they've been resourced to do as such. So we are as prepared, I think, as any jurisdiction can be here in Saskatchewan. But the reason that we're able to actually have this conversation most certainly is because of what individuals have done in this province.
Follow up, Arthur?
Yeah. When we were cranking up the restrictions, there were some cities and towns that wanted to move more quickly. Will cities and towns and other municipalities have the option at all of moving more slowly? If there's a city that wants to keep current limitations in place for longer, will they have the right to do so?
These are provincial restrictions that have been put on, and in a large part, I think virtually all of them, outside of maybe the international travel self-isolation, which is a federal restriction. So they will be removed as a province. In saying that, Minister Carr has been in touch with municipal leaders across this province, what began on a daily basis, then I believe went to a bi-weekly basis, and now may even be at a weekly call. But she continues to be in touch with all municipal leaders across the province, and specifically in touch in particular with those communities where we are working much more closely, if you will, from a healthcare delivery perspective to ensure that they have the resources from the public safety agency that they may require. So we wouldn't expect that. We wouldn't expect that municipalities would be requesting to move out of step, if you will, with the province. In saying that, where there may be a localized flare-up or anything of that nature, we will be working with those municipalities very closely. And we may, and you may have something to add to this, Dr. Shahab, but we may have, if there is a flare-up, a certain community where there are further restrictions that are specific to that particular community to ensure that we can isolate any flare-up that may come in the number of positive IDs so that it isn't spread to the rest of the province. So that conversation may come, but I would view it as much more of a collaborative conversation between the province, the Chief Medical Health Officer, the Saskatchewan Health Authority, and the local leadership. We have done this with a number of northern communities. We had a very open conversation with a number of northern leaders as to should we shut northern Saskatchewan down. The local municipal leadership throughout the north had indicated that they would like to monitor and control the access in and out of their communities from a healthcare perspective, and we agreed that is how we would move forward. So we've had some of these discussions as these restrictions have come on. We've approached them very collaboratively, and I think for the most part successfully as well. But anything to add, Doctor?
Yeah, so I think what we have seen in Saskatchewan at a very small level, but certainly what we have learned from other jurisdictions who are facing this at a larger level, is that whenever you have an outbreak or a cluster, it's very complex. It's not just a complex work setting. It's, workers then come home and live in households where there may be other household members who may be working in other settings that are also high risk, like home care or community care. So obviously each cluster needs to be managed in that integrated approach. It's not just a work setting, it's households where people live at, it's who works from that household in other settings. So we've tried to mitigate that as much as possible in terms of guidelines for workplaces and home care and long-term care settings. But having said that, if there is a localized cluster, it has to be managed in that broad approach. What's happening in the work setting, what's happening in other linkages that through households may be in other sectors. That whole community may need to go under a heightened level of surveillance, which may include increased testing. And then in that setting, there may have to be some specific provisions or restrictions that may have to go in effect for a limited period of time that are not in place in the rest of the province. But that, I think, will be very important as we go forward. Not so much as because of what we've seen in Saskatchewan, but certainly some of the complex outbreaks in work settings and spillover into communities that we've seen in other places in Canada and North America.
We'll take our last question from the floor, staff.
Yeah. Can you say which provinces you've shared this plan with?
Off memory, I can, but anyone that requested it, we shared it with.
Okay. Was one of your goals in presenting and putting this plan together being the first? Because again, to Arthur's point, Saskatchewan seems to be the first province coming out with a detailed list timelines when these restrictions are going to be lifted. So is being kind of first among the provinces your goal in this at all?
No, absolutely not. The first priority with this plan was to ensure that we are keeping Saskatchewan people safe. And we have the tools in place so that we're able to do that. The testing, the robust testing regime, the contact tracing, the ability to isolate, to ensure that we have the capacity in our healthcare system to manage anything that may come from this. So that's number one, is to ensure that the people of this province are safe. Number two is can we make every effort to reopen those segments of our economy so that the families in this province have the opportunity to remain in their careers, remain at work, and remain in some degree of what would be considered a normal life situation. We are trying to allow Saskatchewan families to get outdoors, to get not only on the golf course but to our parks and to our recreational sites, but to continue to practice, and we can't stress this enough, to continue to practice the appropriate physical distancing measures that are in place, and continue to ensure that they are doing everything they can, as they have been, to flatten this curve and reduce the spread. Those are the goals of the plan that we have here today. We've been working on it quite diligently for some time, and we are, due to what Saskatchewan people have done over the course of the last number of weeks, is the reason that we're able to be here today.
And that concludes our time for today. Thanks for joining us, everyone.